What is middle ear? The middle ear is the portion of the ear medial to the eardrum and distal to the oval window of the cochlea of the inner ear. The middle ear contains three ossicles, malleus, incus, and stapes, which transfer the vibrations of the eardrum into waves in the fluid and membranes of the inner ear. The primary function of the middle ear is to efficiently transfer acoustic energy from compression waves in air to fluid membrane waves within the cochlea. A 34-year-old man comes to the clinic with a 3-week history of difficulty hearing. He finds it increasingly difficult to tolerate everyday sounds. He also complains of ear pain and often avoids public places as a result. The patient has no past medical history and takes no medications. Injury to the cranial nerve's 7th facial nerve is most likely responsible for the patient's condition. The middle ear cavity contains 3 auditory ossicles, malleus, incus, and stapes, and 2 skeletal muscles, tensor tympani and stapedius. They participate in the transmission of sound from the tympanic membrane to the cochlea. The stapedius muscle arises from the wall of the tympanic cavity and inserts on the neck of the stapes. Stapedius muscle is innervated by the stapedius nerve, a branch of the facial nerve cranial nerve 7. The stapedius muscle functions to stabilize the stapes. Paralysis of the muscle secondary to an injury or lesion to the facial nerve causes the stapes to oscillate more widely, producing hyperacusis. Patients will typically complain of increased sensitivity to everyday sounds, for example, shutting doors, ringing phones, traffic, and will often withdraw socially as a result. Treatment consists of retraining or sound therapy using broadband noise, for example, white noise. White noise is a random signal having equal intensity at different frequencies, giving it a constant power spectral density. The tensor tympani muscle arises from the cartilaginous portion of the auditory tube and the adjoining part of the sphenoid bone and inserts into the malleus. Tensor tympani muscle functions to contract the tympanic membrane medially, thereby increasing its tension and dampening sound transmission. It is innervated by the mandibular branch of the trigeminal nerve, the 3rd branch of cranial nerve 5. Ipsilateral hyperacusis is a common finding associated with Bell's palsy unilateral peripheral facial paralysis. Bell's palsy is a condition that causes sudden weakness in the muscles on one side of the face. The accessory CN11, glossopharyngeal CN9, hypoglossal CN12, and vagus CN10 nerves are not associated with hyperacusis. The stapedius muscle is innervated by the stapedius nerve, a branch of the facial nerve. Paralysis of the stapedius muscle results in hyperacusis, for example, increased sensitivity to sound,